Health for a Lifetime, brought to you by the National Council on Aging.
I have emphysema, and I also have osteoporosis.
I have kidney disease, arthritis.
I need help. I can't do it by myself.
High blood pressure, heart disease, diabetes. Today, 4 out of 5 older adults are living with long-term health problems. As many as half are juggling 3, 4, even 5 conditions at the same time. The high cost of long-term illness consumes a staggering 95% of all senior health care spending. And too many older adults find that their health problems interfere with the relationships and activities they love the most.
In my church, I'm a greeter, an usher, and I'm a prayer warrior. I must stand. Well, I'll tell you, it was the hardest for me to do that. And I began to dread Sundays.
For people with long-term health conditions, 95% of their care is actually self-care. And patients and physicians agree that the traditional office visit can't provide all the support they need.
The real challenge is getting people to change their behaviors. And changing behaviors does not happen in a 20-minute, 15-minute office visit. It takes a lot of effort, a lot of repetition, and a lot of support. It actually takes a village.
The solution? Community-based workshops called chronic disease self-management programs. Participants get encouragement from each other and practical advice on living better with their conditions.
I wanted to know, how do you manage this? How do you manage blood pressure? What are the things I should not eat, and what are the things I should eat?
These workshops and others, like Matter of Balance, Healthy Ideas, and Enhanced Fitness, are credible research-backed programs that help older adults put life back in their lives.
People with chronic illness live more than 99% of their time outside of the healthcare system. And what we're trying to help them do is live that 99% of the time. We're not doing diagnosis, we're not doing treatment. We're helping them get on with their lives in the face of chronic illness.
Workshops meet once a week for 6 weeks. The meetings are interactive, include people with many different conditions, and are run by trained peer leaders or coaches.
I think it is very good to use lay leaders because many of them have chronic diseases themselves and can relate to the same things that the people in the class are talking about.
So what we try to do is get people to set weekly goals of something they would like to do and that they really think they can do. So it may be walking a little bit. It may be writing a letter to a friend. It may be eating 1 more apple a day. Little things.
We set our goals and then we tried to do it, and I increased my exercises from 5 minutes a day, and I got up to 15 minutes a day, and I felt I was doing well.
Here, older adults build their coping skills by creating realistic weekly action plans for diet and exercise.
Walking them all, right? Walking them all.
Building self-confidence.
Good. I'm glad that you did do it.
Learning self-care and communication skills, and finding a supportive community.
And this way, I knew the people and felt they were my friends, and I could discuss it more openly.
It was the help of others that made me say, I can do this.
One of the surprises was how much we have grown to learn and love the program. Everyone who participates on a class leader level always ends up coming back talking about the sheer joy, and it's that, happy people feeling.
Chronic disease self-management programs deliver real-life results for older adults and a tested, cost-effective option for healthcare providers.
We see these improved results at 6 months, at 1 year, and at 2 years, still making a difference in people's lives. It's also appears to lead to reduced use of the emergency room, in some cases reduced use of inpatient stays.
I think the most important part was that the participant came into realization that they have the responsibility to take care of their own health. And there's not only the doctor or somebody else that have to take care of their health.
I've changed quite a bit from how I behaved before. And after the class, I'm able to manage my disease.
By the end of the program, I would run in here, and the end of I said, I can do it. Let me tell you what happened to me. I said, I'm standing, I'm walking, I'm enjoying it, and I said, people are noticing the change in me. Welcome to Central Baptist. And honestly, people began to notice, they go, Bernice, you're still standing.
I have more energy, there's no doubt about it. I have more energy. I feel as though I'm standing straighter. I feel as though my posture's better. I just feel good.
Health for a Lifetime, brought to you by the National Council on Aging. Support for this video was generously provided through grants from the Atlantic Philanthropies and the Administration on Aging.